I'm Dr. Jeanelle de Gruchy and I'm Director of Public Health for Tameside. After a month of slow but steady increase, Tameside unfortunately now has the highest rate of coronavirus infection in Greater Manchester and its 11th highest in England. The latest figures give the borough's rate as 405 cases per 100,000, which is a significant rise on the previous week. We are seeing an increase in outbreaks in our local businesses, which is causing disruption and shows that there are high rates of infection circulating. We're also seeing now an increasing number of cases among those who are over 40, which is concerning and shows the need to continue to protect people, especially our most vulnerable. While life may seem to be getting back to normal, we still have a high level of COVID circulating, and the need for getting yourself vaccinated, testing if you are symptomatic or if you come into contact with somebody who has COVID, and just keeping the basic hygiene measures in place is more important than ever now. We need to protect yourself and those around you, and we need to avoid the continued disruption to our lives. So vaccination remains the most effective thing you can do to safeguard yourself against the virus. It needs to be the 2 jabs. It's the double vaccination that is the most effective. So while a single shot does offer a degree of protection, double vaccination increases the level of protection significantly. So make sure you get that second jab. With the vaccine now available to anyone over 16 years old, I'd encourage young people to get their jab, especially ahead of the new term starting. That will really help everyone keep safe and reduce disruption. To make getting vaccination easier, we've got local vaccine hubs, and they will continue to be open on set days in the early evening throughout September. Details of when they're open for you to just drop in for your first or your second dose after 8 weeks, to get AstraZeneca or to get Pfizer. All those details can be found at www.tameside.gov.uk/COVID vaccine. If you don't want to drop in to one of those local vaccine hubs, but you want to book an appointment at one of the hubs or at one of our pop-up clinics, just head straight to the booking site, which is www.tameside-glossop.nhsvaccinations.co.uk, or call your GP practice. Alternatively, you can book at one of the mass vaccination centres by visiting www.nhs.uk/coronavirus-vaccination, or you could call 119. In addition to vaccination, I would encourage everyone to remember about testing. Testing for COVID also remains really important. If you've got symptoms such as a high temperature or a new cough, please get yourself tested. Get a PCR test and self-isolate. Don't go anywhere until you receive the result of that PCR test. To book the PCR test, visit www.nhs.uk/coronavirus. So the PCR test is if you have symptoms or if you are a close contact of somebody who does have a positive test. We also have the rapid testing. Those are the lateral flow devices, and we are still recommending that you use those twice a week as before. And that's to pick up if you've perhaps got COVID but without symptoms. Not only does it help protect others, but it also helps reduce the high rates of infection and the risk of new variants developing. Those rapid testing kits can be picked up from our pharmacies and libraries in Tameside. Finally, please remember to continue with the basic measures of washing your hands, wearing face coverings, particularly indoors or where it's crowded, keeping your social distance from others, and meeting outdoors, or if you're indoors, open the windows, let in fresh air. I know that's going to get more difficult as the days get colder, but it still remains really, really important that we keep the basic measures going and make sure that we've got fresh air, we socially distance, we wear our face coverings, particularly indoors or in crowded spaces, and we wash our hands. COVID hasn't gone away, and it is at a high level, unfortunately. So we have to be realistic, we have to continue to be cautious, we have to do everything we can to reduce the infections and to protect others and continue to enjoy the progress we have made.